Everyone has their own eccentricities or awkward behaviors. Sometimes, however, a person will begin to experience strange patterns of thinking and behaving, and struggle to form relationships with others. This condition is a chronic mental illness known as schizotypal personality disorder (SPD). People with schizotypal personality disorder are often identified as having an eccentric personality. They might take magical thinking, superstitions, or paranoid thoughts very seriously, avoiding people whom they irrationally mistrust. They also might dress strangely or ramble in speech. These behaviors can make it difficult for them to form close relationships and succeed at work or school. Researchers do not understand exactly what causes schizotypal personality disorder, but they believe it is a combination of genetics and environmental factors. People with a first-degree relative with schizophrenia are at increased risk of developing the condition. For people genetically predisposed to developing SPD, experiencing psychological trauma or chronic stress can also increase the risk of symptoms emerging. Researchers estimate the lifetime prevalence of SPD to be roughly 4%, with the condition affecting men slightly more than women. Roughly half of people with schizotypal personality disorder have experienced at least one episode of major depression. People with bipolar disorder, post-traumatic stress disorder, borderline personality disorder, and narcissistic personality disorder are also at higher risk of having schizotypal personality disorder. The signs of schizotypal personality disorder include three major components. The first is a decreased capacity to form close relationships, which can cause a person severe discomfort. The second is experiencing distortions in one's thinking or perceiving of events. The third is exhibiting eccentric behavior. In younger people, schizotypal personality disorder may first manifest as attention problems, social anxiety, or interest in playing or working alone. Kids may struggle with being teased or bullied, which can further heighten social anxiety. To receive a diagnosis, a person must have experienced these signs by the time they reach early adulthood.
A person also must have experienced 5 of the following symptoms:
Lack of close friends outside of immediate family, eccentric or unusual beliefs or mannerisms, belief in superpowers i.e. telepathy or superstitions, excessive social anxiety associated with paranoid fears, paranoid thoughts or doubts about others' loyalty, interpreting harmless events as having a personal meaning, dressing in an unkempt or odd manner, sensing an absent person is present, strange or rambling speech patterns, flat or limited emotional responses. A person cannot receive a diagnosis of schizotypal personality disorder if they have a diagnosis of schizophrenia, any other psychotic disorder, autism spectrum disorder, or a diagnosis of bipolar disorder or depressive disorder with psychotic features. When being evaluated for a personality disorder, many people find it useful to bring along a friend or family member who has observed their behaviors and can offer insight to a doctor. You also might want to gather information about your family's medical history, in particular whether there is any history of mental illness or stories about peculiar behavior or beliefs.